+251 +251 Alternatively, you can ask your questions live and also utilize the question and answer section on this Zoom platform. Please note that today we are ending our press briefing at 11:45. So please be very ready with your questions as soon as Dr. John finishes with his briefing so that we can take as many of them as possible before we have to adjourn at in 45 minutes time. All right, let me now bring in Dr. John, who is our usual host, and he's on standby. Dr. John, good morning, and you have the floor.
Good morning, Wayne, and colleagues and media. A very warm greetings from Addis Ababa, from the Africa Centers for Disease Control and Prevention. Thank you all for honoring our weekly press briefing. Today, as in previous weeks, I'll do three things. Look at the epidemiological situation, evolution of the situation on our continent. Second, look at what Africa's CDC posted, and then conclude and vaccination efforts across the continent. So let me start with the epidemiological situation. As of today, over 4.3 million COVID cases have been reported across all 55 member states. This accounts for 3.3% of all total cases globally. The total number of recovery stands at 3.8 million. That represents 90% of the overall infection, that is of everyone who has been infected on the continent. Unfortunately, 114,000 deaths have been recorded across all 55 member states, and that represents a case fatality ratio of 2.7%. The global case fatality ratio continues to be stabilized at 2.2%. So our 2.7% is by a few points higher than the global average. In terms of the variants, the numbers have not shifted a lot. 19 countries are reporting the presence of the B117 variant, and another 18 countries are reporting the presence of the B1351 variant. So we see that these numbers continue to increase as expected. As the virus mutates and people move around, we expect to see these variants continue to spread. With respect to the changes of the trends over the last 1 week, the week 13, which is this week, if we compare this with week 12, we see the following trends. One is that 80,000 new cases have been reported across the continent, and this represents a 4% increase in the total number of cases compared to last week. The highest proportion of new cases came from East Africa, and that is about 37% of the new cases. And if you look at the other regions, we see the following breakdown. Northern Africa witnessed a 32% new cases, Southern Africa 15%, West Africa 9%, and Central Africa 7%. The following 5 countries reported the highest number of new cases last week. Ethiopia 14,000, Tunisia 10,000, Kenya 8,700, South Africa 6,500, and Libya 5,800. In terms of deaths, if you compare last week and this week, we recorded about 1,900 new deaths across the continent, and this represents a 2% decrease compared to the previous week. So as usual, let's also look at the trends over the last 4 weeks. The following trends were observed, that is between March 8th and April 4th. In terms of new cases, there's been an overall 4% average increase in new cases across the continent in the 4 weeks. The following are the breakdown by regions. East Africa, 22% increase. 10% increase in Northern Africa, 6% increase in Central Africa, 10% decrease in Southern Africa, and 12% decrease in Western Africa. So if we now look at the breakdown by the most populous countries on the continent, Kenya, we've observed a 36% average increase. Ethiopia, 20% average increase. Egypt, 5% average increase, and decreases in 3 countries. South Africa, 4% decrease. DRC, 14% average decrease, and Nigeria, 31% average decrease. In terms of deaths over the last 4 weeks, we've observed a 2% average decrease in new deaths across the continent. Let me now transition to the testing and the capacity building efforts. So as a continent, we have conducted a cumulative total number of cases across the continent at 41 million. So 41 million tests have been conducted since the pandemic started. If you compare last week number of tests and this week, there was an increase of 2.5%. The case positivity rate is around 10.5%, and the ratio is exactly where the WHO is recommending for appropriate testing. Nearly 1,500 people, the rapid tests that are similar to the polymerase chain reaction, the molecular tests that are gold standard for COVID-19 testing in 17 countries over the last across the continent, including Congo, DRC, Zimbabwe, Malawi, Sudan, Chad, Central African Republic, Guinea, Sierra Leone, and South Sudan. With regards to medical supplies, as we said earlier, our strategy is to continue to focus on the case management. So we are especially supplies of oxygen. So in that effort, we have shipped out the following to Sudan: 16 oxygen concentrators, 8 mechanical ventilators were also shipped, 12 oxygen concentrators to Zimbabwe, 17 oxygen concentrators and 7 mechanical ventilators to Malawi, and 62 oxygen concentrators to the Democratic Republic of Congo. So all of that is in recognition of the need that hospitalized patients are in need of just basic oxygen supplies. We continue to train member states and build their capacity in partnership with Project Hope and the Brown University for healthcare workers' capacity to vaccinate. And a total of 554 healthcare workers were trained by Africa CDC last week, and that represents an increase of over 10%. Our goal is to scale this up progressively as we move on. So let me now conclude by focusing on the vaccine updates. A total of 33.8 million vaccine doses have been acquired by member states, with approximately 12.9 million doses administered. And as of today, 31 member states have received their consignment of COVID vaccines from the COVAX facility, resulting in a total of over 16 million vaccines or doses received so far. So let me then share some good news across the continent with you. Two countries, Seychelles and Mauritius, have received enough COVAX vaccine doses to reach 20% target vaccination benchmark, which was what the COVAX facility promised. So I think every little step and progress that we observe in the continent is good progress. So it's always good to highlight those success stories. Seychelles, for example, has vaccinated 64% of its population, with nearly 38% fully vaccinated with 2 doses. I think that is important, very good progress. So Seychelles is receiving vaccines from the COVAX, but also receiving vaccines from their bilateral arrangements. Morocco is recognized as having administered over 4 million doses of the COVID-19 vaccines, which is the most doses on the continent to date, with nearly 11% fully vaccinated with the second doses. So let me conclude by just focusing on the AstraZeneca situation that we all are learning and as we move forward. Recently, this week, the European Medicine Agency Safety Committee, in abbreviation PRAG, indicated that unusual blood clots with low blood platelets should be listed as a very rare side effect of AstraZeneca vaccine. I think that is the first time that the European Medicine Agency is indicating that. However, the recommendation still stands that the benefits of receiving the vaccine outweighs the risk of this unusual and rare side effects of the vaccine. The UK Joint Committee on Vaccination and Immunization also have issued some guidelines that are worth mentioning here. It's that one, the benefit of prompt vaccination with AstraZeneca vaccine far outweighs the risk of adverse effects for individuals 30 years of age and over, and those who have underlying health conditions which put them at higher risk of severe COVID diseases. They further add that adult age less than 30 years without underlying health conditions that put them at higher risk of severe COVID disease should be offered an alternative COVID-19 vaccine if available. So I think that concludes our briefing on the COVID situation as we saw it this week. I will now return it to Wayne for you to manage the question and answer session.
Yes, thank you very much, John. And the first question is directly related to your the last part of your briefing, and it is coming from Maggie Fick, and she is with Reuters. So she says, what is your reaction to the European and British health regulators' announcement yesterday that they have found possible links between the AstraZeneca vaccine and rare cases of brain clots? I think that there she wants you to tell us whether you are still recommending that Africa should use AstraZeneca. And then she goes on to say, are you concerned given that AstraZeneca makes up the vast majority of doses that African nations expect to receive through COVAX? So that's from Maggie Fick of Reuters.
So very good question there. I think there are two parts to that question. So the first part is, what do we make from these recommendations from the UK and from the European Medicine Agency? One thing should be very clear. When you roll out vaccines, especially new vaccines, you back that up by a surveillance program, which is you're looking at all possible side effects in all transparency. And if you have good systems, you pick signals. And that is what is happening. So I think it also speaks to good systems that are in place to pick those rare signals. The key word here is the rareness of these occurrences there. The other thing to note is the transparency of the communication, both from the medicine agency is clear. The benefits outweighs the risk, because these are very, very rare occurrences that they are picking up due to a very strong surveillance systems that they have put in place. So I think these vaccines continue to be safe. We would still recommend that the vaccines be used in this situation and circumstances. With respect to concerns for the continent, remember that we and others, including the World Health Organization, regional office in Brazzaville, have also put in place a system to continue to monitor the side effects and rare occurrences of any other events across Africa. So again, let's credit what the European Medicine Agency have done, because by having those strong and enhanced systems, it enabled them to pick a very rare event. I think that should be interpreted in the positive light.
All right, thank you. We go to our WhatsApp platform and we have two questions that are coming from Sophie Mukwena. And Sophie is the foreign editor at the South African Broadcasting Corporation. So she says, we have recently experienced pockets of conflict in Africa. For example, in Cabo Delgado in Mozambique and in Tigray in Ethiopia. What impact does this challenge have in the fight against COVID-19 and the access to vaccines? So that's the first part of her question. She has a second one, and she says, when is Africa going to receive its vaccine consignment? And what is the Africa CDC's position on the proposed vaccine passport? That's from Sophie Mukwena.
Yeah, thank you, Sophie, for the three excellent questions. So the basic principles of fighting a pandemic or an outbreak is that conflicts do not bode well with the ability to fight a disease. I mean, that is simple stated. So in any area of Africa, country or region that we experience conflicts, COVID-19, be it in the ability to roll out vaccines, impose or actually implement basic public health measures. So conflicts are really detrimental to any efforts to fight the pandemic or outbreaks. We saw this in DRC, not keep away. It took us more than 2 years to beat back the Ebola outbreak, even though we had all the good tools in the field. I mean, we had good monoclonal antibodies. We had 2 vaccines that could be used for ring vaccination, but yet because of the conflict there, it took almost 2 years to defeat. It's really not good for the ability to rapidly eliminate or fight a pandemic. With respect to South Africa, South Africa has also received vaccines from will also receive vaccines from the COVAX facility, as well as their own initiative, which is the bilateral deals, which I'm not in a position to. I'm not privileged to that information to be able to share with accuracy when South Africa will receive the other doses of vaccines. I think the national program, I think the minister is part of the African Vaccine Acquisition Task Team, should be in a good position to explain that to you. Your third question on the passport is our position is very simple, that any imposition of a vaccination passport will create huge inequities and will further exacerbate them, because we already are in a situation where we don't have vaccines, and it will be extremely unfortunate that countries impose travel requirements rest reached out and is working with the African Union to raise up to about $2 billion as part of the efforts to support countries in the process of grants, but long-term loans. And that is one. The second thing is that you all are aware of the conversation that is going on with international donors like the World Bank, the IMF on the special drawing rights, okay? And the AU, the UN Economic Commission on Africa, they're all working with the Ministers of Finance, the F-15, to really come to a common understanding that there's need for African countries to have access to the special drawing rights that will enable countries to have cash to support the vaccine acquisition and vaccination programs. Because as we have stated before, vaccines plus vaccination equals life saved plus economy safe. So investing in vaccine acquisition is not just a health issue, but it's also an economic issue, which I think the ministers of finance across the continent are working very closely to conclude that agreement. That is the agreement meaning the special drawing rights. I hope I answered that question. The second part of the trusted travel and immunization is that I believe next week, the Commissioner of Transport, Commissioner Amani, will be hosting a meeting in that area of a consultation on how do we get the whole issue of travel with immunization, a proof of immunization certificates, and working with airlines, not necessarily as a passport to travel, but as evidence that people have been immunized. So we'll be on the watch. I think that commission is leading the efforts. We will be working closely with us as well, the Africa CDC, to support that initiative. And that will all be embedded within the Trusted Travel platform already. The Trusted Travel was launched last October solely as a mechanism to ensure that when people travel with a test, the test result is actually accurate. And that will continue to be the backbone on which we build in any further immunization certificates or immunization passport. So be on the watch on that. We will keep you updated as the efforts continue to expand.
Thank you very much for that, John. Let's say hello to Paul Adepoju, and he's with the Lancet. His first question was regarding the vaccine passport, which you have already tackled. And then he goes on to say, what is being done at the Africa CDC to ensure that other health issues are not sidelined by the focus on COVID-19? And he has a second question. What should African countries do to ensure that they are always able to meet the health challenges, new or old, including non-communicable diseases? Those are two questions from Paul.
So, Paul, those are very good questions. And there are the huge challenges that come with fighting a pandemic with respect to the impact on other diseases. And there are at least 4 different immediate challenges that we are keeping an eye on. That would be the immunization programs, okay? The current, that is the non-COVID immunization, like measles in children and others. Traditionally, once you're dealing with a pandemic of this scale, those programs will suffer. But the good thing is that some countries in the midst of this challenge have been able to demonstrate that if the vaccines are available, they can immunize, they can continue to reinforce or carry out their routine immunization. Like Ethiopia vaccinated 12 million children in the middle of this pandemic. It means other countries can do it as well. So that is the point I'm making here is that member states should not neglect those programs. It can be done despite the challenges that, otherwise the consequences after this will be very, very serious. The HIV, TB, and malaria programs are also a huge area of concern that the UNAIDS is making projections showing that the number of excess deaths due to HIV because of these programs have been affected will be significant going forward, including, of course, the TB and the malaria program. That is why a huge program like the Global Fund has taken upon itself to acquire additional resources from donors to invest in fighting COVID and not necessarily the HIV, TB, malaria, which is their core mandate. So it is all in recognition of that. Last night we were on an advisory group meeting too late, or discussing how to use the COVID challenge to fight and ensure that systems are in place to protect the HIV, TB, and malaria programs there. So I think this, then of course the non-communicable disease programs will suffer the hospitalization for cancers, diabetes, and other related diseases. The traditional will suffer from the lack of attention or lack of healthcare workers that are devoted to fighting those other affections. With respect to what countries must do to prepare themselves, there are at least 4 things that we have to do. One is that we have to be very deliberate that you do not go to a gunfight with a knife. I mean, Africa as a continent is facing multiple challenges. I think in the scale of, we're at war with multiple diseases. I mean, the ones that I've just listed, and other emerging and re-emerging infections like the Ebola. Ebola in Guinea, in DRC, didn't wait for us to finish fighting COVID before they reappear. So we need to do the 4 things. As one is, each member state must strengthen its own national public health institute. That way we work closely with the Africa CDC. Second is really our own workforce development. That is, public health workforce development has to be prioritized and be seen truly as an investment, not a cost to the government. I mean, you don't go to fighting a battle without soldiers. I mean, the soldiers for fighting these pandemics are public health experts, which we lack so much. The third is, of course, partnership with the private sector. We have seen a lot of innovations that have come to be extremely valuable in our struggle against COVID-19, orchestrated from the private sector. And lastly is our own domestic funding. I mean, without our own domestic funding, we cannot continue to count on external funding all the time. External funding should come in to cap what we already are putting on the table as our own share to fight these the pandemics or the wars that are just described, the disease wars that are just described. I call out of those strengthening our health defenses so that we can prepare our continent for eventual development and meet our Agenda 2063.
Thank you, John. Judith Akolo with the Kenya Broadcasting Corporation has 2 questions for your quick responses. So she says, we have had travel restrictions in 5 counties in Kenya. And those are the counties that had the highest infection rates in the country, but the numbers are not coming down. So what should Kenya do differently to flatten the curve of this 3rd wave? So that is her first question. The second question is that President Suluhu Hassan of Tanzania recently announced that they will be setting up a task force on COVID-19. Now, has Africa CDC been approached to assist in this? Or what is the Africa CDC planning to do with this new development in Tanzania?
So thank you, Judith, for those 2 excellent questions. I have absolutely no doubt that Kenya is going to flatten the 3rd curve. They have done that with the first wave. They did that successfully with the second wave, really beautifully with the second wave. And I'm sure that they will do that with the 3rd wave. Absolutely no doubt about that. We saw them struggle with these waves and then bring it down. The thing is, it's not just Kenya, it's all countries. Those are the circles of a typical pandemic. You go through several waves until you end up having vaccination. That is why vaccination is so key in our ability to bring down and keep it where it is. It all has to do with human behavior. It has to do with the 4 things that we've all discussed here: ability to avoid gathering, mass gathering, or even gathering with at least 10 people to 20 people. If you do that, you offer space for the virus to transmit. Ability to continue to impose self-discipline and improve hand hygiene. Ability to wear masks consistently. Okay, and also government to subsidize the public to wear masks, okay, all the time and make it affordable, because it might be assumed that it is just a few shillings or a few dollars or even cents to buy a mask, but for a common person, it might be challenging. So I strongly call on all governments across Africa to subsidize good quality masks. It's very important that we also keep an eye on the quality of the masks that we are using. If we do those things all the time consistently, then we would have no doubt that Kenya will bring down the third wave significantly. But the game changer in this will be access to vaccines. Clearly, public health measures alone will not enable us to win the battle against COVID-19. We'll continue to see these waves come and go, and that is destructive for human lives, destructive for our economies. With Tanzania, we are extremely encouraged with the signals that we are hearing from Tanzania, from the new leadership, and Africa CDC has engaged in the process of offering its technical assistance to the government of the new government of Tanzania. It is very welcome news that we are hearing from Tanzania, like you, and we look forward to engaging with them further as they move forward with the task force. But they have not officially requested anything from us, but it doesn't mean we will not engage with them. We will engage with them using all channels in order to offer our help to them.
Thank you very much. We have about 10 minutes to go, so we need to run through this very quickly. So let's turn now to our WhatsApp, and this is a question coming from Valerie Turner. And Valerie is a freelance reporter with Swiss Media. So Valerie says the increase of the B1XXX variants circling on the African continent raises concern about the currently available vaccine, AstraZeneca, and its protection, as South African scientists have proved that AstraZeneca offers only minimal protection for those variants. Is there a plan B in vaccine acquisition in terms of efficacy of an alternative product through COVAX or other sources? Now, let me join that with a question from Rodney Muhumuza. And Rodney says, what is the recourse for countries such as Ghana and Rwanda, which administered their vaccines efficiently and are now waiting for second doses that may be late in coming?
So the two questions are related. For the first question, remember last week we did announce that the AVAC, the African Vaccine Acquisition Task Team, has secured 220 million doses of vaccines and have an option of acquiring an additional 180 million doses of vaccines. I think that will bring it up to about 400 million vaccines. And given that the Johnson & Johnson vaccine is a single dose, that means we have the ability, if those vaccines are picked up by countries, to immunize up to about 400 million people on the continent, eligible people on the continent. So I think that is what it is. We said last week also that these vaccines will begin to, based on the agreement, begin to be available around the beginning of the third quarter. So the greatest challenge we have now is how do we bridge the time now, which is mid-April, to beginning of June or July. I think that is the critical period that we will be all struggling with. If the shipment of vaccines from the COVAX was not interrupted because of the situation or scenario in India, we would have had a nice coverage between now to June, and then from June or July upward, our own deliveries will kick in, and even more COVAX deliveries will come in. But as I said last week, the situation in India will greatly impact on our ability to maintain a specific schedule in a predictable manner, because in a good vaccination program, predictability of availability of vaccines is very, very important, so that you know when and how to use your first doses, and how to counsel people that have received their first doses to come in and get their second doses there. But again, as I said last week, the situation with the Serum Institute and the government of India imposing restriction, it makes it very complicated for our vaccination program across the continent.
All right, we go to Addis Ababa. We come back to Addis Ababa to say hello to Addis Getachew. And he says he would like to know the reasons why the cases in East Africa have been growing over the past few weeks.
Well, the reasons is simply that we are dealing with a virus that spreads very quickly, and we just don't know if this is due to the fact that new variants are being introduced. I mean, only very good epidemiological surveys will tell us that, and it's human behavior. I mean, we have to adhere to these practices that we've outlined very clearly during this meeting and other previous meetings. And that is just the nature of how pandemics occur. They come in waves, and also build on the fact that there's pandemic fatigue, which means people are used to adhering to certain measures, but at a certain point, of course, they get tired of those measures. But my encouragement to the entire continent is do not relent on those public health measures. It's the only tools that we have in our hands right now, and is the only effective tools. Masks are the best vaccines that we have for now, and we cannot relent on those. If we do that and maintain hand hygiene and avoid congregation of people together, then we have a good chance of continuing to maintain keep the virus at bay while waiting for a large-scale vaccination, which will not come quickly. I mean, with all the complications that we have discussed in this forum.
Thank you. Lawrence Caramel of Le Monde says, what do you know about Nigerian efforts to produce its own vaccine, and where do they stand right now?
Unfortunately, I don't know much about the efforts in Nigeria. I know that there are very good researchers in Nigeria that are working on those, but we have not, I can't expand on that any further and about their current situation in Nigeria producing specific COVID vaccines.
Thank you very much, John. Let me just come back to another question that is coming from Maggie Fick of Reuters. And she says, has the African Union abandoned plans to buy AstraZeneca vaccines from the Serum Institute of India in a bilateral deal?
Answer is yes. And it's not because of the reasons now, but it's because we work very closely with COVAX. I mean, since the first doses were agreed that COVAX will get those doses and start with the vaccination program, we now shifted our efforts to the Johnson & Johnson arrangements. And that is what led to the agreement of last week, so that the Serum Institute was enabled to be able to supply doses to the COVAX mechanism. Again, that close coordination and partnership with COVAX is very important for us. So we didn't drop the deal, but it was just a clear understanding of how not to duplicate efforts with the Serum Institute, so that we complement each other rather than duplicate efforts.
Thank you. We go now into our last question, and it's coming from Sarah Jerving, who is with DEVEX. And she says, yesterday, the United Nations Vera Songwe said that only 70,000 people on the African continent have been fully vaccinated with 2 doses. But the figures that you gave on Morocco contradict that. Was she not including North Africa?
So I'll need to listen to what she said clearly before I can make any informed comments on what she said. I would like to actually see the full transcript of what she was referring to. Unfortunately, I didn't. I'm not privileged to what she said yesterday or this week.
All right. Since that response was pretty short, maybe we can just take this last one from Della Russell with the Daily Graphic in Ghana. So she's referring to the issue that you talked about earlier about NCDs. So she says, who is monitoring to see whether attention is being given to non-communicable diseases in the fight while the world is concentrating on the fight against COVID-19?
No, thank you, Dola. The beauty is that before COVID hit us, one of the major focus of the WHO was the NTDs and many countries have developed their national NTD programs, non-communicable disease programs. So WHO Afro continues to monitor that, and of course Geneva as well as individual member states. So that is not been neglected, it's just been monitored, and we continue to also emphasize that. If you recall that when we launched our strategic plan, it had 3 pillars. One was to prevent transmission, the second to prevent deaths, and lastly, the harm. When we define harm very broadly as the impact of COVID on both the economy and non-COVID related affections and diseases like HIV, non-communicable disease. So we continue to push countries and raise the awareness that they cannot neglect those components. But it's all about health systems. If your hospital is full of COVID patients and people are reluctant to go to hospital to seek care because of fear of COVID infections, the overall systems becomes very constrained. So that is the harm that a fast transmissible disease like COVID-19 and with its complications brings to bear on the health system. So we continue to work with member states to advocate for them not to neglect non-communicable diseases.
Thank you very much. Let's go now into your summary of your key points from today's briefing.
No, thank you, Wayne. I think the key points from today's briefing is, again, the focusing on the uptake of vaccines. It is really a sincere request to countries and to the media and the community that we join forces to fight off this misinformation and inaccurate propagation of false information with respect to vaccines. There's plenty of that in the social media, and I think our greatest concern and fear is that it becomes a predominant factor in this equation, which would not benefit anybody. The vaccines are safe, and if we should not interpret what is happening with the AstraZeneca vaccine as that a failure of vaccines. I think it only speaks to the fact that you have put in place, that they have put in place in Europe and elsewhere, strong surveillance systems to pick even very rare events. I think that should be interpreted in the light of what it was that led to the identification of those rare events. So I think it is a strong wish from the Africa CDC to continue to encourage African countries to take up the vaccines quickly, because I underline the word quickly, because without vaccinating quickly, then we will not be winning the battle against COVID-19. I think that is really my message to all of us. That is a collective effort. It's a collective responsibility and collective accountability that will be able to roll out vaccinations across all member states. Remember, vaccines plus vaccination equals life saved and economic safe.
Thank you very much. That was Dr. John Nkengasong, the director of the Africa CDC, concluding today's briefing, which, as we mentioned at the beginning, would be 45 minutes long instead of the normal 1 hour. But I want to thank you very much, colleagues. We've really tried to look at all 3 platforms. That's the WhatsApp, the question and answer session, as well as the live section, to make sure that we answer as many of your questions as possible. We thank you, as usual, for your continued interest in covering the issues of COVID-19 on the continent. Well, we conclude our press briefing for today here, and we meet again on Thursday next week, same place, same time. Bye-bye for now.